Good evening, everyone. Today we have something very interesting to discuss on. We're going to talk about smile transformation. And I'm going to show you a whole lot of cases today which we have treated. Now, smile transformation is becoming extremely popular these days. With the advent of cosmetic dentistry, dental braces, Invisalign, and a whole lot of other methods like, composite fillings, the people are opting for it every now and then. But a lot of people ask us as to what is the right method of doing it. Now we are of the opinion that if you want to do smile transformation, make it as simple as possible and as natural as possible. Which means that unless and until you know multiple root canal treatments, multiple putting of crowns is required, I would advise that you should go by natural means like dental braces or aligners so that you don't have to carry something artificial for the rest of your life. And these are very young patients who are going ahead with these forms of treatments as they want to increase their quality of life, which they always deserve. But let's not go ahead with the quick fire procedures because it might be very, very harmful to your teeth at a later date. So let us see a few cases. This is a patient who comes to us with irregular teeth. Gave us about 16, 17 months of time. We did dental braces on him, and you can see the beautiful smile that he had got. He basically came with crowded teeth. Now, this method is a very natural method of treating a smile. You don't put anything artificial, and hence you don't have restriction in diet or anything for the rest of your life. That's one good thing. The other good thing is that there is no cutting, trimming, or shaving of teeth that you do in this procedure. And once you don't damage your teeth, damage your enamel, it is bound to stay for long. The longevity of the teeth is increased. So I would say that unless and until it is an absolute necessity or an absolute indication, uh, doing root canals, trimming, shaving of teeth, and then going ahead with instant smile designing is not a great long-standing option. So look at the next case. So this is a patient who comes to us with spacing in teeth. Now he feels that his teeth is crooked. He also feels that his front teeth are long in size, they are much bigger. And he also complains of a lot of spacing in teeth. Now we went ahead and did dental braces on him, regular dental braces, metal braces. And you can see the beautiful smile that he got at the end of the treatment. Everything natural inside the mouth, no restriction in diet for the rest of your life. A lot of people fall for a lot of advertisement that comes up in the internet or a lot of ads that comes from companies these days about digital smile designing and instant smile designing. But I'm of the opinion that this method is probably the best way forward for you in the future, and it has long-standing benefits. So here is another patient, and this is a very unique patient because this patient came to us after getting treated by two other doctors. She still had this huge gummy smile, and her face didn't look good. She was unhappy with the looks. The one thing that we learn out of this case is that you should get treated. Uh, you should choose your doctors wisely. That's number one. Because every other person claims to be an orthodontist or a smile designing expert these days. Um, and you really don't want like this to happen to you. So she has got treated from two doctors now, and then she is absolutely unhappy because she has gummy smile, she had proclined teeth, and she hated herself actually. We did dental braces and we put mini implants. This is not a surgical case. Okay, nowadays we can do a lot of cases non-surgically. So we put mini implants or tabs, which are small button-like things placed within the gums, and they are not invasive at all. Uh, and we did a bit of laser at the end of the treatment and got a beautiful result. So this is an art of retreatment. Treatment is easy if you are starting it afresh, but then when something went wrong in a medical field, to get things back requires a lot of skill, and a lot of experience. So I would say that to young people that don't go for cost cutting and market surveys about cost. It's your life, and you should get it done from a very experienced clinician, preferably an orthodontist, and someone who is able to show you umpty lot of cases before starting your treatment. So I always believe in the fact that you should get it done from a doctor who is able to show multiple treatments that he has done, because these are all cosmetic procedures and it's about your face. It's not about a scratch in your hand or a scratch in your leg, which goes unnoticed. So it's about your smile, it's about your face, and it makes a huge impact to the confidence of the patient and how you will lead your life in the future. So here is yet another case of a patient with gaps in teeth. Uh, it's a very easy form of treatment once you get started from experienced people. So she started afresh, and then we were able to treat her in the next 10 months. So you can see that she had twisted teeth and she had gaps in teeth and she got treated with dental braces. She's extremely happy at the end of the treatment. So here is another case where this patient had multiple missing teeth. He also felt that the upper two teeth were long at the start of the treatment, but a lot of doctors suggested him that he should go ahead with uh, uh, implants or correction of put multiple bridges. But then someone suggested him that he should go and align his teeth first, because if you align your teeth into the right place, the amount of cutting, shaving of the teeth during prosthetic rehabilitation, which means that when you are putting artificial teeth, becomes much lesser. So the lesser you cut surrounding teeth, the better it is for you in the long run. So what we did for him is that we put him on braces, and then we went ahead and um, you know uh, and treated him for about a year or so, in which we positioned the teeth into the right place. And at the end of the treatment, he got a beautiful smile. And we did go ahead with the crowns and veneers at the last, but then minimal trimming of teeth was required. So here is another patient who came to us with gaps in teeth. This is one of the most commonest problem that patient comes to us with. The patient also had thumb sucking habit in childhood, and his tongue was a little bit large in size. And we treated him with regular braces treatment. They're very natural, hardly any artificial stuffs inside the mouth. So all the the ads, promos, and all that we see about quickfire smile designings, I think they should be. I'm not saying they are bad, but then they should be chosen very wisely, because if they are not chosen well by your specified qualified doctor, then it might grossly damage your teeth. So that's the awareness that we want to promote it to the general people. So here is another patient who comes to us with a huge gummy smile. He feels that his whole upper jaw is forwardly placed. And yes, it was. So the patient was suggested to go ahead with surgery. Now you have to understand that nowadays we have been able to convert a lot of surgical cases into non-surgical and give fabulous results, as you can see how his results were at the end of the treatment by using dental braces and bone screws or mini implants which are stuck onto the teeth and the gums. Once their work is over, we just remove them. So patient can get treated for such severe problems without surgery. That's a great thing, because orthodontic surgery is not a small procedure. Okay, you have restrictions for about 1.5 uh, months or so, and then you have to go ahead and get the surgery done, which might cost you a lot of money. Uh, so I'm not telling that you should not go ahead and do surgery, but I feel that if it can be treated by non-surgical means, you should avail the recent methods that are available. And if at all your doctor feels that this is way too severe to be treated by non-surgical methods, you need to go ahead and do the surgery also. So we have a lot of surgical cases, but this patient was treated non-surgically. She actually came to us because a lot of doctors told her that it is not possible to treat you without surgery. But we did treat her, and you can see the results that she got at the end of the treatment. Now, if you feel that We are putting up all these lectures which make you interested in them. You can go and subscribe us in our YouTube channel. You can scan this and you can just click on the subscribe button below. Here is yet another case of a patient who came with gaps in teeth. Now, this is a patient who had already undergone braces treatment with someone before. She did not wear retainers, okay, which is the mandatory at the end of braces treatment. And she was irregular with the doctor also. And she confessed it to us. So we went ahead and did a retreatment for her. She was as sincere as she could probably be. And she keeps wearing retainers nowadays because she got a beautiful smile at the end of the treatment. So we all have to understand that whenever you are getting treated with braces, it is essential that you follow the instructions of the doctor because things might pop back if at all you don't follow them. For patients who really follow our instructions, nothing happens in a lifetime. So they're all very happy. So here is yet another patient who came to us with multiple retained deciduous teeth, which means that she had a lot of milk teeth in her mouth. The teeth has come airy-fairy, some had come was inside her jaw, and some of them were placed in the palate. So you can see this, that she was not happy with the smile. So what we did was that she went ahead and did braces treatment with us, and we were able to give her a fabulous result at the end of the treatment. You can see the smile transformation that she got. Now, this is yet another case, okay, and this is about lingual braces. Now, this is a patient who was treated a couple of years back by us. He came with gaps in teeth, and he didn't want, he to go ahead with traditional braces because he was working, and he wanted some invisible options. Although now Invisalign has become very popular, but a lot of people wanted lingual at that point of time, lingual braces. So these are braces which are put from inside the teeth. But the problem with lingual braces is that it's difficult for people to talk because it might create small ulcerations in your tongue and it might bother your speech a bit. Now, therefore, they are becoming obsolete these days. That's because all these professionals who want invisible braces are also talking a lot throughout the day during their working hours. So you really want to have something comfortable inside your mouth. That's very important because it's not only about looks, it's about comfort. But then we were able to give him very good results at the end of the treatment with lingual braces on. I told you that it is not very popular these days because of some constraints in speech and difficulty in carrying it. And we have better options like aligners and Invisalign these days. So this is the result that we got with lingual also. So what we want to focus on is that whether it be any form of treatment, your doctor is the most important part. Because you can have a very good car but if your driver is not good, then you don't get to the destination. So here for you, the doctor is the most important thing. Okay, so choose your doctors wisely and ask him a lot of queries during the consultation process so that you are able to clarify your doubts before you start the treatment. Now, here is another case of dental crowding. So this patient came with multiple cavities because uh, her teeth were all irregular, and therefore she was not able to brush well. And therefore, people who were not able to brush well will have a lot of cavities. So we advised him her dental braces. She was coming from a far off place. She was coming to Kolkata from Tripura. That's about 1.5 hours flight every month. But she had a trust on us, and she went ahead and did the treatment. You can see the fabulous smile that she got at the end of the treatment. And then we did the fillings for her. A lot of times, okay, if you don't align teeth and do the fillings don't stay for long. And the fillings cannot be done properly on irregular teeth also. So what our advice is that whenever you're doing prosthetic rehabilitation or restorative part, which might involve fillings, crowns, veneers, and all, uh, make it a point to ask your doctor whether the teeth is well aligned or not. Otherwise, he might have to do a lot of cutting and shaving of the other teeth, which might damage the other teeth. So here is another patient who had come with gaps in teeth. She had problems. She suffered from microdontia, which means that all her teeth are very small in size. So that's um, you don't see that very often. But here is a patient who came with that problem. So according to the size of his face, the teeth were very small. And therefore, since she had small teeth and multiple missing teeth, there were gaps. So we told her that go ahead and put braces, align the teeth into the right place, create gaps for the teeth which are missing, and then go ahead with artificial stuffs. But she was young. So what we did after braces treatment, we had to put temporary crowns for her. And then when she becomes about 20 years of age, what we would do is that we will go ahead and put permanent crowns or veneers. So not every time is it possible to put permanent things in young individuals. That also need to be kept in mind. And you need to trust your doctor on that part. So here's a unique case of Invisalign. Okay, and now Invisalign or aligners are becoming very popular these days. So a lot of adult patients who had missed out on braces treatment or want to get their smile fixed and are hesitant in wearing braces because they are shy that the people might notice that they are getting it treated, goes ahead and put aligners and Invisalign. Now, Invisalign is a type of aligner. Okay, it's a brand of aligners. But the problem with most of the aligner systems in the market is that they don't have a proper research and development. It's a new system, so whenever you are using on patients, okay, I suggest all my juniors and young doctors is that you should go ahead with a good brand of aligner, because I have seen too many failure cases of aligners with cheap aligner brands, uh, which I don't want to mention. But aligner treatment is like 50% digital backup, because it is all the aligners are 3D printed, and it's technology which is helping you to make aligners. It's not like braces where the doctor puts on the braces and can manipulate and change the position of the teeth by bending wires and other things. It is something which is crafted from before. So you need to have a good company to support you during the course of the treatment. So I would say that in an aligner treatment, about 60% of the contribution comes from the doctor, about 40% of the contribution comes from the aligner company. So even if your doctor might be great, if your aligner company is not good or not providing great aligners, you will not get good results. We trust Invisalign on that aspect. And therefore, this is a patient who came with gaps in teeth and felt her upper teeth was jutting outside. She got a beautiful smile at the end of the day, absolute perfect smile. Uh, we did a scanning of her teeth initially and then went ahead and she put aligners for about 12, 13 months and got a beautiful smile. So you understand that in certain cases, okay, apart from your the quality of the doctor concern, the quality of the materials that is put inside your mouth plays a pivotal role in the quality of results that you will get in the future. So here is a patient who had gaps in teeth and was an adult, but then she felt that aligner and Invisalign is slightly costlier proposition for her. So she went ahead and put the Damon dental braces. Okay, Damon is one of the best possible company of dental braces that is available in the world these days. And she wore white braces. Okay, so they are ceramic braces. So they are not as prominent as the metal braces. Uh, they are white in color. I'm going to show you in the future slides. But she didn't wear aligners. But you do see that she got a beautiful smile at the end of the treatment. So it all depends on who is treating you. Uh, what is the skill of the person who is treating you? It also depends on the quality of the product being used. It also depends on how much you are supportive towards your doctor, which means that you need to have a lot of compliance. Okay, you should listen to the instructions of the doctor also. So all in all, it's a teamwork to give such good results. Here is another case where this patient comes with uh, multiple missing teeth again and ariphides. So a doctor told him that go ahead and trim all your teeth and put crowns. Once we looked into the case, we found out that he will require crowns at a later date. But if we start doing it initially itself, we have to trim. We have to do intentional RCT. So you have to take out the nerve from the teeth, okay, so that you can trim the teeth more. Otherwise, patient might feel pain. Also, this might lead to a lot of trauma to the teeth. So what we told the patient is that go ahead and align your teeth into the right place. So this guy went ahead with our opinion and aligned the teeth and positioned the teeth into the right place first. And then wherever he had missing teeth, we put crowns and bridges. So you can see the beautiful result that he got at the end of the treatment. I know we did put crowns at the last, but since we did braces before and put the teeth into the right place, we had to trim the teeth very less as compared to if we were not doing braces. So that's very essential. We always believe that the lesser you trim teeth, the lesser you and the more natural you keep the treatment, uh, the better is the longevity of the treatment basically and the results. So, so always try to go for a more natural form of treatment rather than too much cutting and too much. It might look fancy because it can be done very in a very short duration of time, but in the long run, or maybe 2, 3 years or 4 years down the lane or 5 years down the lane, you might feel that you took a very, very wrong decision. So here is a patient. Not every patient comes adults. Here is a patient whose mom was very aware that these things needed to be treated well, and brought him early at 14 years of age with irregular and forwardly placed teeth. So you can see a lot of irregularity of teeth. What we did was that we did dental braces on him, Damon dental braces, gave a fabulous result. We were able to expand the jaw a bit. And then we did a bit of laser. So you have to understand that cosmetic dentistry is not about just cutting off the teeth. Your smile has two components, basically your teeth and the amount of gums visible, and your lips, the upper and lower lip, how much they elevate during a smile. So whenever you see a beautiful smile, you have to understand that it's a component of a lot of things. So here we did braces for him. And then at the end of the treatment, we did a laser recontouring of the gums to give him a beautiful smile. So we are also available on the Instagram. You can just scan this code and follow us on Instagram, or you can just type GLOC_Imperial_clinic. And because we keep uploading a lot of cases, our treatment results in the Instagram. So we'll go to the next part. Okay, this is a patient who comes with forwardly placed teeth. Okay, and he feels this teeth is jutting out of the mouth, and she had a lot of gaps in teeth. She also feels that her upper teeth were small in size as compared to her face. So what we did with her is that we put her on dental braces for about 14 to 16 months of treatment. And in that part, we were able to align the teeth and push back the teeth and close up his gaps. And at the end of the treatment, we did a bit of laser so that the size of the teeth actually matches now with the size of her face. So you can understand that the smile transformation has a lot of tricks and trades and requires a lot of skill. So you really want to get it done from a very, very skilled person. So here is another patient who comes to us with an extra teeth in the center. Now that's called as the mesiodens. So you can see that she has two teeth and there is a one conical teeth in the center. So that is seen in a lot of patients. Okay, that is something, an extra teeth might pop up inside the mouth, which is though unnatural. So what we did is that we removed the extra teeth, and then we had gap, and then we put him on her on braces and fixed her smile. As simple as it gets. My suggestion to all my patients listening to this presentation is that see there are umpty ways to treat patients. But you should talk to your doctor. Ideally, you are supposed to visit an orthodontist, uh, not a general dentist, because an orthodontist is more skilled to get this form of treatment done for you. Uh, so, that market survey in today's world, that you don't get lured too much by advertisements, but ask for evidence from your doctors. Okay, that, okay, I have this problem. I want to get it treated. Can you show me a few cases how you are able to handle something like my case? And everything get exposed. So if he is an experienced person, he will be able to show you a lot of clinical results that he has been able to achieve with other patients. So here is another patient who comes to us with gaps in teeth. Every other patient comes with gaps and irregular teeth. She was coming way from far. She was coming from Jharkhand. Okay, that's about 8 hours travel by train. Uh, and she trusted us and she got the treatment done from us. We told her at the last that whenever you close gap, you need to get a laser done. But she told that I'm really happy with the treatment. Just don't want to get the laser done. So you need to respect people's opinions as to what form of treatment they want. All that you can tell patients these days is to propose something and let them decide what they want for themselves. So here is another case. Okay, this is a patient who had whose artificial teeth kept falling every now and then. Okay, so you can see that the multiple teeth are trimmed for him initially, which means that he has undergone prosthetic treatment called as a dental bridge. Now, since his upper teeth, his lower teeth were going and hitting the upper bridge, every now and then that bridge was falling off. That's because he had something called as deep bite. Now, for all the people fixing artificial teeth for you needs to understand that uh, unless and until you have a very good bite, uh, whatever artificial you place in the mouth is going to fall off, because every time you chew, there is a lot of load on that artificial stuff, and then they fall off. So what we did for this patient was that we told him that, okay, we can't do a bridge for you, only because your bite is too deep, your lower teeth is going and hitting the upper teeth. So what we do is that we put on braces for you. We'll put the braces for you, align the teeth in the right place, we correct the deep bite, and then we have adequate clearance. We'll be able to uh, do the bridge work, and that will never fall off. So now he's probably finished his treatment about 1.5 to 2 years. He was coming from northern side of Bengal, okay, a place called Kuchbihar, and he never came back after that. So whenever patients don't come back, you know that he is happy with it, or he doesn't have any complications. Otherwise, you get calls from them, okay, if at all something goes wrong. So here is another case of spacing, and this is a patient who came to us. She herself is a doctor. She is a neurophysician. She said that I have gaps in my teeth and my lower jaw is tilted to the left. And we understood that, okay, she was very aware of it. So what we told her is that, okay, we can correct the symmetry of the jaw also if you are able to do braces treatment well in certain cases. Not every time does it require surgery. So we'll go ahead with the best possible braces available in the town, and we put him on Damon braces. And you got a beautiful smile at the end of the day. Whatever jaw asymmetry that she had initially, as you can see that she had a perfect smile at the end of the day. The jaw asymmetry correct, because sometimes jaw asymmetry is because of the wrong positioning of the teeth inside your mouth. Because if the teeth are not in the right place, they guide the jaw to a wrong position, and then you feel that your face is crooked. Not every time does this forms of treatment require surgery, but yes, certain cases of severe asymmetry might require surgery, and your doctor would be the best person to guide you through it. Now, here is another girl. Okay, she is a national level table tennis player. She came to us with telling that my a lot of gums is visible for the back teeth in my back teeth, which means that she has posterior gummy smile, and my teeth are jutting out and they are irregular, and I really hate my smile. So after about 18 to 20 months of treatment, because this was a very complicated treatment to start with, you can see the fabulous smile that she got at the end of the treatment. Okay, she just looks perfect now. She looks a different person altogether. All these professionals coming to us, when your smile, when your looks, okay, when your get up, everything is all perfect. Uh, Professionally, you are able to grow better in life because your psychological status is about a lot of extra confidence that you get because you believe in yourself. So all these adult patients who have missed out on orthodontic treatment or braces treatment or any form of aligner treatment or cosmetic dentistry are opting for this form of treatment uh, a lot more than the yesteryears, only because they believe in improvement in quality of life. That's the key. Here is another guy who is a school teacher. Adult patient comes to us with gaps in teeth, gets treated by Damon Dental Base. He wore ceramic because he was getting. He's an adult. Okay, he's a school teacher. He has a public life, and he thought that okay, aligner is a bit more costlier than braces. So he went ahead with ceramic braces, and you can see the beautiful smile that he got at the end of the treatment. So what we want to tell to our patients is that whatever is the method uh, that we are choosing to treat you, that's probably a bit secondary. Uh, I think the skilled hands and your cooperation with the doctor is the primary prerequisite for good treatment. And yes, if you're able to give good materials, okay, which would obviously enhance the quality of the results that you are getting. So here is another adult patient who comes with spacing, gaps in teeth and teeth jutting out. And he also got similar beautiful smile at the end of the treatment. And here is another case. This case we need to discuss well because this is a case of Invisalign. Now, this is a girl doing PhD in Singapore. She comes with an anterior open bite, which means that whenever she's biting, her upper teeth, her front teeth doesn't match. So she can't even chew with her front teeth. Every time she talks, the tongue keeps popping out and it looks very awkward. She also has gaps in teeth, and she can't wear braces because she feels that she's too shy to wear braces. So we told that the only option that you have is lingual braces or Invisalign. Now she told that, okay, I need to talk too much. I need to give a lot of presentations. I can't wear braces, which is going to bother my speech. So lingual is out of the question. So the only option that was left was Invisalign. And now she stays in Singapore, so she's not able to come too often. So we told her that, okay, we can digitally craft as to when you want to visit the doctor, because in Invisalign, there are options of staging the treatment, which means that at what stage of the treatment you want to do what. Because, all these are prediction form of treatment. Nowadays, you are able to see how you will look before your treatment has started. Okay. Uh, that's a great advancement that we have had in dentistry these days. So we went ahead and did Invisalign for her. And she took about 14, 15 months of treatment. She was a very sincere patient. Okay. Invisalign requires a lot of sincerity because, you can uh, put Invisalign on and put back. It's removable, right? Okay. Not like braces, which are fixed onto the teeth. So with Invisalign, you have great options like, okay, you can eat anything and everything, no restriction in diet. You can brush really well because you can take out the Invisalign and brush. In case of a social event, you can just remove the Invisalign, attend the party, and then come back and wear the Invisalign again. And speech is never a problem, and no one understands that you're getting the treatment done. So that's all that you want as an adult. And you can see the great improvement in smile that she got at the end of the treatment. That's absolutely fabulous transformation to smile that she got. Yeah, here is yet another patient who got treated with braces. So not everyone does Invisalign. So a lot of people are go ahead and do braces because they're slightly cheaper than Invisalign. This girl said, I don't want to remove my teeth while aligning. So we understood that it is not a case of not every irregular teeth cases requires extraction. Okay. Some people feel that whenever you go to an orthodontist, they would remove teeth. No, not like that. If you have gaps in teeth, you might not remove teeth. Okay. If the orthodontist feel there are a lot of non-extraction methods these days, like little bit of filing of teeth, which has to be done very judiciously. Otherwise, it might damage the enamel. So that experienced hand is again very important. And this patient we treated without teeth removal. Okay. She wore Damon braces, so which is able to expand the jaw a bit, and then she wore a bit of elastics to settle the bite, and she got a beautiful smile at the end of the treatment. Okay, see how confidently she is smiling. So now that we have discussed a lot about the results, let's see what are the methods of treating it. Now, we know that cosmetic dentistry, you have lots of methods. One is the natural method in which you use dental braces and aligners or Invisalign. And there is something called as artificial method like cosmetic bonding, which is like you use composite to fill up those gaps, uh, and you naturally craft the teeth. And then you have something called as veneers, in which you use ceramic covering over the top of the teeth to get it to your smile face. Although crowns, veneers, and the dental bonding, which is composite restorations, are the quick fire ways of treating your problem, but they have a lot of limitations. Okay, they cannot push back teeth. A lot of trimming of teeth is required. So I won't say that you should not do it. I would say that you should do it when it is required. Not just you want to do something fast, so you go ahead and do something really fast. Because you know the biggest challenge to medical fraternity these days is that you need to get good opinion, good doctors giving you good opinions, which would be long standing for you for the rest of your life. So that's very rare these days. Okay, there's a lot of commercial driven treatment plans which are given. A lot of companies have come into the picture who wants to enforce their product and say that this is the best, this is the best. So I would say you as a person, as a doctor who has been practicing for over a decade now, is that always go ahead with the natural means. It might take a bit of time, but they are all worth it. Okay, you will never have to have a restricted life for the rest of your your lifespan. And you can eat anything and everything. And you don't have to visit the doctor, because every artificial teeth that is placed inside your mouth will have certain level of validity, duration. Okay, stay for 5 years, stay for 10 years. And then you have to keep visiting your doctor forever. So you're stuck with your doctor. I always believe that when you really want to do good treatment, okay, after the treatment, you needn't visit your doctor. Okay, maybe a slight follow-up, a little bit of cleaning is good. So the most natural way of treating your smile is either dental braces or aligners, actually. So metal braces, okay, the only problem is that uh, if you wear it, okay, people will be able to understand that you're getting the treatment done. So if you want something invisible, where people want to, so that you're a bit shy, you can wear ceramic braces, okay? So it reduces the amount of visibility. And if you want absolutely invisible, you are supposed to use aligners, and the best aligner probably in the market as of now is Invisalign. So I would put a caution to this. There are a lot of duplicate aligners, a lot of aligner companies have come into the market and they claim that they are as good as other very good aligners. I am of the opinion that no. If you want aligners, which means that 50% is doctor skill, 60% is about doctor skill, and 40% is about the quality of the aligners, which is going to determine your treatment, you should go ahead with the best aligners available in the market. Cost cutting on aligners is a bad option, because if you do cost cutting, there is a compromise on the quality of the product, and even though the doctor is great, will not be able to give you great results with it. So I would say that if you are budget conscious, then don't do aligner at all. Go ahead and do dental braces, so that you get at least the result that you expect. Braces are going to be able to give you great results. Invisalign, okay, or other very good aligner companies will be able to give good results. But all the cheap aligner companies who just want to encash on patients by giving them fake, hopes, those things you need to be very aware that uh, about the results of it. And even feedbacks nowadays are bought by companies. So you really need to go to a doctor, a very qualified doctor, to know what exactly is good for you, and then decide on the type of the treatment that you want. And I am sure that most doctors are going to guide you in the right way. Now, situations have changed, trends have changed, and what has happened is that patients want to see how they will look at the end of the treatment beforehand, before they start the treatment. So for all those people looking into this video, just scan this code. The smile of your dreams is just 10 seconds away, which means that if you scan this code, you will be guided to an app. And if you take a selfie of yours, or someone takes a photograph of yours, you will be able to see that if you are getting an orthodontic treatment done, or braces, or cosmetic dentistry done, how will you look at the end of the treatment? It's not perfect, but it will give you about 50-60% idea as to how you might look like that. That's a great motivational factor. I've been doing this for years, and patients just love doing it because they're able to see how they will look in the future. So go ahead and scan it. It's a free one, and you will be able to see how you will look at the end of the day, provided your doctor is skilled enough to give this result. So after this presentation, I'm sure you're going to have a lot of queries. What you can do is that you can just go into the comments the button below and comment and ask queries, and we'll be more than happy to reply to your comments. you might have a lot of queries. I'll try to attend to them all. If at all you feel that you want to come to us, okay, uh, you're most welcome. So our clinic has lots of recognitions from India and abroad. That's there is Great Lakes Dental Clinic and Orthodontic Care, and we are settled in Kolkata, and we don't have branches outside Kolkata. So if you want to follow us and see the work that we are doing, you can go to Instagram and just scan this code, and you'll be direct to Instagram. That's GLSC_Imperial Clinic. If you want to see us in YouTube or already viewing the YouTube channel, okay, you can subscribe. If you want to see us in Facebook, you can always scan the code, and you'll be directed to our Facebook page where you can see umpty lot of patients, their feedbacks, reviews, and the results that we are giving predictably. The age of, doctor is going to try, we're going to give you about 80-90% result is gone. We are able to give you that perfect smile that you're hoping for maybe years together. If you want to know more about us, you can go to our website, www.greatlakesdentalclinics.com, or contact us in our reception, and we'll be more than happy to answer to your queries. I think this presentation has given you fruitful informations about how do you want to approach these forms of treatment, rather than getting lured by companies or financial driven organizations who probably don't think much about the patient, but tries to gain out of you. So as a doctor, I feel it's a moral responsibility to inform you as to whenever you're spending on something, what is it that you should spend on? Where should the difference lie? What should you ask your doctor? I'm sure when you have done this well, uh, you are going to get the results that you are seeing in this video. Thank you so much for going through this and subscribing us and looking into our YouTube channel. Okay, it's always a pleasure to communicate with you all. Thank you for a patient listening, and good night.